Hello and good evening, everyone. Welcome to the 103rd Blades Virtual Seminar. Blades Virtual Seminar is a platform that allows healthcare professionals to discuss current management updates of different health-related topics for better patient care. And today's virtual seminar is sponsored by Yene Health. Yene Health is a femtech company, a pioneering organization focused on women's sexual and reproductive health. Yene Health is committed to improving healthcare services across Ethiopia through advocacy, education, and e-pharmacy services. So today's platform is brought to you by Yene Health in collaboration with Blue Health Ethiopia. And Blue Health Ethiopia is a medical consultancy company founded by medical doctors and a computer engineer. And we aim to be an influential healthcare leader in creating a skilled community through easily accessible knowledge and preventive medicine. And I'm your host, Dr. Ihino Tadele, a general physician and first aid trainer from Blue Health Ethiopia. Today, it's a pleasure to have Dr. Abel Mestie here with us to have a presentation on the basics of telehealth. You might remember Dr. Abel from his previous presentation on the basics of digital health. If you have missed that session, you can find it on our YouTube channel. So for those of you who don't know Dr. Abel Mestie is a seasoned professional in the field of digital health, boasting a diverse range of experience. He is the project manager for the Ethiopian National AMR implementation project at Digital Health Activity, USAID, and has led the technical team to success. Dr. Abel is also the proud founder of Digital Health Digest, a newsletter with over 4,500 subscribers on LinkedIn, exploring the latest trends in digital health, a platform dedicated to delivering the latest news, research, and insights in the field of digital health. Currently, Dr. Abel serves as the Chief Program Officer at Mobi Health International. So, Dr. Abel is a digital health project manager at Orbit Health and a co-founder of Social Duty Alliance as well.
Thank you so much, Doc. Good evening, everyone. Thank you for joining me today to explore one of the most transformative areas in modern healthcare. Today we'll be covering about telemedicine and telehealth and telemedicine and the basic science related to the ecosystem. We'll start by defining both telehealth and telemedicine, their difference, and also we'll deep dive into their brief history, global, African and Ethiopian market traction, and also we'll go through the benefits, the challenge, and also the technologies that are currently being used. As we all know, the last few years have driven a fundamental shift in how healthcare has accessed and delivered telehealth. Once this technology has been seen as a supplementary tool and has now become a cornerstone for healthcare for millions of people worldwide. Today we will be covering both the telehealth and telemedicine, their difference, their benefits as well. We'll start with their definition and distinction. Most of the time, as you know, it's usually used interchangeably. Telehealth and telemedicine, they have quite different definitions. So for telehealth, it is more of an umbrella term encompassing a range of technologies and services to support remote healthcare, including non-clinical services. It can be in regards to education, in regards to provider training. It's usually associated, linked to non-clinical activities, and it has broad health services as well. When we talk about telemedicine, telemedicine is a subset of telehealth focused specifically on clinical service delivered remotely, for example, diagnosis, treatment, and also monitoring. The distinction is telehealth covers broader health service, but telemedicine is exclusive for clinical services. The brief history when it comes to telehealth, as I have mentioned earlier, telehealth encompasses a wide range of health service delivered remotely and has evolved significantly over the past few years. Mostly, it's actually traced back to the 1920s and also early 1900s. So, in the early beginnings, the concept of telehealth emerged with the use of radio communication. So the initial usage was related to radio communication, and one of the notable initiative was the Aerial Medical Service, which is located in Australia, and it was mentioned that it was founded by a person named John Flynn. Their initial initiative or the initial work was related to the radio and aircraft so that they can provide medical care to remote areas. Then, when we come to the 1950s, the first initiative during this period was the University of Nebraska, which they used a two-way video communication for medical consultation and medical education as well. And this was marked by the first instance of real-time video communication in telemedicine, allowing clinicians to transmit neurological examinations to students across campus. Then, in 1960s, telehealth gained traction in rural areas supported by the government initiatives, and this was actually initiated during this period by the NASA. So NASA was involved in such projects where they developed different telemedicine projects to monitor astronauts' health during space missions, and this demonstrated feasibility of remote healthcare delivery. Then after in 1970s, the federal government funded actually several telemedicine projects aiming at improved access to healthcare in underserved and remote regions, and particularly on American Indian reservations through initiatives like space technology applied to rural Pago Advanced Healthcare project. Then in 1990s, with the internet revolution and introduction of communications related to internet, this revolutionized or optimized telehealth ecosystem by enabling faster communication and data transfer. And this period saw an increase in telemedicine applications, including teleradiology and remote patient monitoring. Then, on top of the introduction of internet and usage, then we have the increased usage. Actually, electronic medical record or AMR was initially started, as mentioned in our previous webinar. It was during the 1960s. But during the 1990s, actually between the 1980s and 1990s, it was the usage of electronics was higher, and such development and investment on AMRs facilitated a better management and storage of patient information, and this also optimized the acceptance of telehealth service. During the 2000s era, there is a huge digital technology advancements. Telehealth continued to evolve with advancement in digital technologies and also the introduction of mobile devices. By the late 2010s, various platforms allowed patients to consult healthcare providers via smartphones, mobile phones, and also computers. And we come to the 2020s, the COVID-19 era. So during the pandemic, this usage and scale up of telehealth service dramatically accelerated with adoption of new technologies. With in-person visits restricted due to health concerns, many health providers turned to telehealth to maintain patient access. As you recall, during the pandemic, there was a global lockdown in most of countries. So rather than going to the clinics or facilities, patients and facilities, healthcare providers stick to the remote communication, remote consultation. As a result, telehealth service expanded to include not only routine checkups, but also mental health counseling and also chronic disease management. Actually, this is where there was a huge acceptance for the technology, and also a huge amount of revenue was gained during this period. So as you recall, last time we discussed about the global market, the African market, and the Ethiopian market when it comes to digital health and also associated applications and the solutions. If you remember, or if you recall, that there was a high segment of increase, or a huge increase when it comes to telemedicine out of other solutions. And many companies or many countries gained a good amount of revenue, especially from telemedicine. So the global market for telemedicine or telehealth has been experiencing rapid growth, driven by the advancements in technology, including healthcare costs, and also the demand for accessible medical service, especially after the COVID-19 pandemic. The global market was valued approximately to $55 billion. This is before the pandemic, and it's currently projected to reach around 175 billion by 2026. This growth is usually attributed to the increasing adoption of telehealth solutions across various healthcare settings, and particularly accelerated and more gaining acceptance after the COVID-19 pandemic. And also technological advancements, innovations in mobile health applications, remote monitoring device, and also video conferencing technology have significantly enhanced the delivery of healthcare service during this period as well. When we look at the African market, the African telehealth market is on a growth trajectory with increasing investments and innovations and actually aimed at improving health access. As you can see, in 2024, it was estimated, or the market was at 4.74 billion, and it's projected to reach to 7.92 billion in 2029. This growth actually reflects rising mobile phone usage and also internet penetration across the continent, which also enables people to access healthcare service remotely. So usually telemedicine applications or solutions in this continent in Africa is being provided through USSD SMS for notification and also usage of the call service, toll-free lines, and others. Despite the potential in telehealth markets increase within Africa, there are also some challenges in relation to connectivity in rural areas and lack of awareness about the telehealth ecosystem. However, currently, government initiatives aimed at improving digital literacy and also infrastructure are expected to mitigate such a challenge. We have major companies like AMD Global Telemedicine, Cisco Systems, and also Philips Healthcare, which are actually involved in expanding the service with such ecosystem. So this one is the projected growth of telemedicine in Ethiopia. The Ethiopia's telehealth sector is rapidly evolving, driven by surge in digital health startups and increasing consumer demand for convenient healthcare service. Currently, it's reported that as of 2023, over 20 healthcare and health tech startups have emerged in the capital, Addis, alone focusing on mobile-based healthcare platforms. And such startups are currently providing service ranging from virtual consultation to health management tools as well. So we know the usual ones or the famous ones who are progressing or who are actually optimizing their platform and gaining a good traction, like WeCare, Enough First, Habari Doc, and also I think Liana Healthcare. These are some of those I am aware of, but I think there are other as well. When we look at the projections, the digital health market or the telehealth, especially in Ethiopia, is projected to grow to approximately 484.4 million by 2029. And this is fueled by rising smartphone penetration and also improved internet connectivity. But still, we're not there yet. Currently, as you can see, we are here, 50. But the graph showed that there will be an increment with the revenue and also the projects of growth as well. What are the benefits of telehealth? The first one is accessibility and convenience. So what do you mean about accessibility and convenience? By leveraging telehealth system or telehealth solutions, we can overcome geographic barriers. As I have mentioned earlier, we usually use telemedicine or mostly applied in remote and rural undeserved community areas, so that this can reduce travel, or it can also reduce operational costs and minimizes the need for in-person visits. So this indirectly help with the cost effectiveness and also the accessibility and convenience for patients within the rural and underserved. But we also use it for the urban area. The other one is to provide enhanced patient engagement. This is related to supporting with regular follow-ups, remote monitoring, and also, which is now a trend, personalized medical care. So let us discuss all of these benefits one by one. So What do we mean by accessibility and convenience? The first one is by leveraging or using telehealth, we can reduce the need for physical infrastructure. This means it will help in expanding healthcare access without physical facilities. So that we don't need to, sometimes we don't need to build additional facilities in rural areas, but by using existing primary health facilities like health centers and also health posts, we can have access to trained and competent physicians and other healthcare professionals. The second one is it overcomes geographic limitation. So this provides service to rural and remote areas, especially for the underserved community. And the last one is for convenient appointments. This will allow patients to receive care from home or nearby locations. This will help in reducing the visits and also the time, and everyone can access to their need, healthcare need, from the comfort of their home. The next one is cost effectiveness. The first one is while using such technologies, we can reduce travel costs and operational costs as well. So this saves costs related to out-of-pocket costs for consultations and also travels for patients. The next one is fewer emergency visits. So telehealth can address many emergency issues, easing healthcare system burden. As you can see, one of the issues in tertiary healthcare, like the Kurambasa, is most of the cases can be managed um, um, in other facilities or in general or primary facilities. By leveraging such technology, we can actually reduce unnecessary visits and usually unnecessary emergency and other OPD visits as well. The other one is this will reduce travel costs, costs that are associated to commuting and also infrastructure. The last one is enhanced patient engagement. These tools will allow for tailored patient interactions. They can help in frequent monitoring as well. When we talk about frequent monitoring, we talk about wearable device and remote monitoring tools, which support regular check-ins. And the other one is with such technology, we can actually have and also evidence in having improved education and resources to manage their conditions more effectively. What are the types of telehealth service? We have different types of telehealth service or the technologies we use. The first one is mobile health applications. When we talk about mobile health application, usually they are applications for patient education, self-monitoring, and lifestyle management. They are associated, they are linked to wearable device as well. When we talk about real-time consultation, these are live video or phone consultation between patients and healthcare providers. And the last one, when we talk about remote patient monitoring, this is also related, linked to the mobile application. This is usage of devices to monitor patient health data, usually remotely, often for chronic conditions as well. What is the current trend and some of the statistics? This is actually post 2020. 54% during the early pandemic. And as you can see, the key statistics, 70% of consumers use telemedicine in 2021. This is in US alone. And 80% of hospitals have telehealth service because of the lockdown and also restricted travel and visits. And the last one is when we see the projected growth, telehealth market is expected to reach over 250 billion by 2025. So this one is according to a recent study. But as I have mentioned earlier, the global market is expected to be 175 billion. So we'll come later and discuss on this one. These are some of the challenges. The first challenge is related to privacy and security concern. And when we talk about privacy and security concern, we're talking about data security and also risk of data breach. For United States, I have mentioned in the previous webinar regarding to HIPAA compliant GDPR in Europe and personal protection laws in our country as well. So unless these are met, for example, in US, if a telemedicine solution does not meet the requirement for HIPAA, then it will not be it will not be in the market to be used by the user or end users because one of the regulation within the HIPAA Act is related to privacy and security. So it said that any solution, not only telehealth, but other digital health solutions must commit or must keep in alignment with the patient data protection and confidentiality and privacy as well. Because there is an increased risk as more patient data moves online. So regular security audits and encryption and user education on such privacy and security should be provided. So if they are not met, then this is a risk, this is a challenge. And in our continent, most of the countries, they don't have such laws, they don't have such legal grounds or any standards. Our country just published in July 24, I think, the personal data use, but it doesn't specifically mention the digital health, the health data protection one. The other one is limitation to technology access. We have this digital divide, which limits access. Not all patients have access to device or high-speed internet, usually in our continent. And also the next one is related to technical literacy. Usually older adults or tech inexperienced patients may struggle with platforms. Usually such platforms are web-based or mobile applications. And usually we need to have some sort of devices to access them. And this is usually a challenge when it comes to rural communities and underserved communities as well. The last one is related to regulatory. So when we talk about regulatory, there are varying license and reimbursement policies from countries to country. So this has created an issue when it comes providing such technologies or such solutions in different countries. So this has been one of the challenges, because most of the time the regulation when it comes to licensing such solutions is not well organized usually in our country and other countries in Africa, Asia, and some part of the Middle East as well. So such kind of absence or lack of documentation leads to a challenge in implementing such solutions, which also affects the acceptance of such solutions. So what does the future hold for the telehealth technology? As you can see, we have some of the new technologies, emerging technologies. We have the AI, artificial intelligence integration, which is a buzzword nowadays. We have the IoT or Internet of Things integration. We have the growth drivers. So what do you mean by this? When we talk about emerging technologies, we have the artificial intelligence, which supports diagnostic assistance, personalized health insights. We have other emerging technologies like virtual reality. Currently, virtual reality is also used in mental health therapies, pain management, and rehabilitation. Actually, it was 2 years back, there was a hackathon here in Addis, and I was able to attend one of them. So one of the winners for the hackathon was a group of young students uh, who uh, who presented who demoed their products using a VR for a mental health actually, and they mentioned that using the VR they were able to come up with a prototype in resolving issues when it comes to social phobias. So it was actually impressive. And also currently, some companies in US are using virtual reality for such issues like depression or depressive disorders and mood disorders as well. The other one is telehealth will continue to expand access and integrate with AI and also IoT for predictive and preventive care. And also this growth is actually driven by convenience, patient demand, and also better or improved healthcare outcomes. One example when it comes to usage of AI in telemedicine platform, there is an application called Abel. I think it's based in UK. So what they do is, so if you want to access or get any treatment or consultation, what you do is you just create an account, log in, and after logging and creating your account, the first interface you will interact with is an AI chatbot. So it will ask you some questions related to your signs and symptoms. For example, if there is headache, then it will ask you some questions. But it will not give you the diagnosis, but what it will do is it will search and find you the right physician or the right specialist for your case, so that this AI they have used different data models to train this model, and it will alert and send notification to that specific physician, which will help you with the consultation. And this has been a good help and also a unique selling point for the company. So by leveraging AI, they have been able to tap into that market and provide their services to millions of patients. So this is it all about telehealth and telemedicine. If you have any question, the floor is all yours. Thank you very much. Over to you, Doc.
All right. Thank you very much, Doctor. So, participants, if you have any questions or comments regarding telehealth, please write down your questions and suggestions or comments in the chat box. So, Doc, you can access the chat box, right?
Yeah, I can. Okay. I think we have the first question from Tagain Bogala. Any regulatory challenge in our context? Do you have any regulation related to telehealth? Apparently, there is none. Currently, the ministry is working on that. Hopefully, it will be published within the coming few months. That's what I know, but we don't have any regulation or any document currently published on telehealth or telemedicine. So this poses a huge challenge when it comes to implementation of such products within the ecosystem. I hope that I've covered your question. Again, if not, I can add
One more question.
Okay.
The visibility of telemedicine in rural areas or remote areas.
Okay, initially, such solutions or the telemedicine was initially planned and developed to be used for remote access, being that it was more for the rural and underserved community, so that they can access the healthcare service. So the issue is when it comes to remote areas, it's difficult to have a smartphone and smart wears or wearable devices. But they have been able, for example, if I'll give you two modalities or two examples. The first one is even if they don't have a smartphone, what they do is using, if they have this a small phone, which we call button phone. It's not a smartphone, but still they can access the SMS USSD message. So what they do is they will get reminders. They can get also consultations from the primary hospital or from centers. Usually, for example, there is an NGO called PAS. In PAS in the last mile health, they were able to implement that USSD and the what do you call this, toll-free line or call centers. They set up in a country. I think it's Congo or Ghana. I'm not sure. It's in a very remote area. So they will send them reminders using the SMS, and also they will reach out to those individuals from the call centers. So it was actually a success because they were able to tackle issues related to ANC disease and also neonatal mortality and morbidity as well. And the second one is, sorry, I might forget that, but the next one is implementing mobile walking teleclinics, which have all the devices, be it remote, the digital stethoscope, digital thermometers, and pickup within the kiosks, or what we call them kiosks, or we call them this digital device. So with that integration with the platform, they are also able to access physicians, specialists by visiting the kiosks, which is actually run by a nurse within the health post or health center. So even though they don't have these phones, but they can also access because services within the health center and health posts they are limited. So by leveraging those integrated telehealth walk-ins or telehealth kiosks or clinics, they can access physicians from Addis and from far away as well. Thank you. Next question. How is the payment modality of telemedicine in our best practice in telemedicine business and any policy? Okay, in our practice, let me give you, maybe if you are aware about WeCare, I will give you two examples. One is for WeCare and one for our company in Nigeria. So for WeCare, I tested it, I think it was 2 years back. You pay, it's called pay as you go, or for every consultation. So if I'm, when I on board when I register to the platform, I provided my fee for a single consultation. It could be 100 birr, 200 birr, or 500 birr. So the payment is based on that, based on what you have selected or added there. So a patient will go through the list of physicians and they can select the one they want to. Then they can have the consultation, and after the consultation, then they will pay the amount initially mentioned. But in our company in Nigeria, what we do is we have different models, but let me give you the example of the first one. The first one is subscription based. So we tapped into the diaspora market so that they can buy different subscription plans for a year. What they do is they can purchase plan for their families within who are living within the Nigerian community, so that they can have access based on that. The other one is we partner with different, they are called HMOs there, but usually here we call them different facilities or different health bureaus, so that the patients will be included within the community health insurance, community-based health insurance, and they will get the treatment with the agreement between the companies and the health bureaus or health facilities within a location. And also, we usually partner with different hospitals so that we can send patients, and also for them to have a service for the telehealth service, we can provide that consultation, or they can use our platform for such teleconsultations, and they can have some partnership agreement, and we get some payments as well. But usually in Ethiopia, it's related to pay as you go. Regarding to the policy, I have mentioned this one. It's still in progress. We don't have a published one, according to my recent research and conversation with some of the experts within the country. We don't have such document, but it's progress. Hopefully, we'll have it in the coming few months. The other one is from Mentasumot Getachew. How can healthcare providers improve patient engagement in other treatment plans via telehealth? Okay, it's a good question. By using telehealth platforms, you can reach out to your patients remotely. so that you can send reminders, you can check their adherence as well. I have mentioned this as an example on the last webinar regarding to a guy from some European country where his physician was able to save his patient's life after the monitoring device or the wearable device was able to pinpoint there was an issue and also send a notification to the physician. So by using different tools that help in adherence and also reminders, we can leverage and we can use and improve the patient engagement. Okay. Any study pre and post telemedicine outcomes of patient care? I can't answer that because I have not specifically gone through such research, but I can share you one of the links on that. The next one is from Rupsam Bari. What are the application of telemedicine in mental health service? We have applications to be used for simple mental issues. We have different modules. We have the one I mentioned earlier, virtual reality, in not treating but in helping regain some memories and also some issues with phobias and these especially social phobias and depressive disorders. The other one is from Haida Mariam. What are the basic infrastructures to implement telehealth in resource limited setting? It is possible to apply in countries like Ethiopia. Yes, it's possible. And the basic infrastructures, the first one is connectivity, the second one is infrastructure, and the third one is related to patients' usage when it comes to mobiles and other devices. But the major two infrastructures are the connectivity and the resources. When I talk about connectivity, that's related to telecommunication, ISP or internet service providers, and also the telecom service. And when I speak about the infrastructure, it's related to such, for example, for like provision of telemedicine kiosks or telemedicine kiosks or telemedicine walk-in or telehealth walk-in clinics. The other one is related to backup power supply. If we need to use the solar or other backup generators. So these are usually the two. Okay, I'm just wondering about the Ethiopian market forecast on telehealth estimated to be greater than 480 million. It's not dollar, but dollar. How do you see about the estimate? Because since we are not the ones who did the research, I think I can share you. Okay, let's check. I can share you the research done here, and you can. Okay, I'll share it. I'm not actually surprised because the usage when it comes to digital health, especially in telehealth, currently the government is investing a huge amount of budget, and from my information gathered, the plan is also for the donor partners to provide a huge amount of investment in telehealth, telemedicine. There is a huge amount or a huge deal of interest in implementing different telehealth, telemedicine solutions within the country. So in the coming few years, that means in 5 years, this might not be just a dream, but something that's possible. And also, our startups are increasing from year to year. Hopefully, we'll get there. But I'll share you the link for the market analysis so that you can also access it. How can telehealth be integrated into existing manual system, healthcare delivery systems effectively? Okay, if you are talking about it's okay, Hello Mariam. Okay, if you are talking about the manual system as if the paper based, uh, it's difficult to integrate it, but we can what we can speak about is having telehealth or telemedicine service as a separate service. Because I think, if I'm not mistaken, there's one or two hospitals who have started that. They have been piloting that for a year now on how they have their call centers, and also they also have such platforms like the one the one we are currently using, which is a web-based. Usually they are used for appointments and also checking for minor issues which are not serious. But I can speak about the integration with AMR. So currently the government is also looking for that as well, because such when appointments are created, they can be linked to the telemedicine platform within the AMR or AHR. That will help in providing the follow-up. For example, if a patient needs appointment for 2 weeks or a month, they can and consecutive months, they can have half of them using the telehealth, which is actually being tested currently. The other one is from Curtis how can doctors prepare to provide telehealth care services? What are the key skills needed? Actually, it's basic. You don't need additional, or you don't need any major skills when it comes to telehealth or telemedicine. Understanding the basic know-how, the definitions, and also the ecosystem. This will put you in a good place. And also the other one is having digital skills. Understanding of the basic mechanisms, and having a good communication skill is all you need. Unless you are heading for the development of such digital telehealth platforms, all you need is a good digital skill. Being good in digital health or in digital skills, and also good communication. The next question is, what are some successful telehealth models in Africa or Ethiopia? I can tell you in Africa, but I'm not sure about the Ethiopian. As I have already mentioned, most of them are related to pay as you go, and some of them are still working on that. But usually, in the African markets, what they do is the subscription based, I have already mentioned earlier, and the partnership model with different hospitals and health centers. This has been one of some of the successful telehealth models. So when it comes to the revenue and marketing, how do we maintain quality assurance of virtually? How do we maintain quality assurance of virtual care? Usually, providing the right amount of training on how to use the platform for physicians or healthcare providers is a good start. The second one is having monitoring and evaluation, and also feedback loop. Having such systems will help you in how such teleconsultations or in how such process are going. So if you have monitoring and evaluation of every teleconsultation, and also providing the feedback loop from both patients and healthcare will help you in maintaining quality assurance. And also on top of that, you can also provide different webinars, seminars, and also the other one is different capacity building activities will also be a good start in maintaining such assurance. How is malpractice monitored for telehealth? Can calls be recorded for telehealth in Ethiopia? Okay, I can't tell you about the Ethiopian status or the standards related to that. Regarding to the one I mentioned about the personal data protection, it talks about hosting patient data in and out of the country, which highlights, or it doesn't actually specifically mention it, but it is not it's not legal to have patient data in a cloud which is hosted in outside of the country. But when it comes to calls being recorded, I can tell you in other countries, which is okay, which is legal as long as it is to be used by the physician and with the consent of the patient. Regarding to the malpractice, usually using the feedback loop, you can trace such malpractice, and usually such platforms are recommended to have a small module or some type of electronic medical record, so that they can have previous records as well, so that you can trace. The other one is you can actually have a clinical decision support system in place with the support of you, mostly currently, which is used artificial intelligence to trace, for example, if a medication is ordered and that medication might have some allergic reaction or some contraindication. So this will provide alerts. One of the such examples is when we add the medication or prescribe, it will tell us that this medication has this kind of contraindication or this kind of side effect for this patient. Are you sure you want to prescribe? So this will limit. It's difficult to monitor and stop, but it's such kind of technologies or such kind of algorithms are in place. It will help you minimize such issues. The other one is from Aganyo. Is telemedicine easily applicable in all health setups of our country? What would you say regarding the majority of people living in countryside? Thank you. Yeah, it's possible, but it needs a huge amount of investment. As I mentioned earlier, if you can implement, for example, the one I was talking about, the telehealth kiosks, I have seen one, and also I have demonstrated the devices. I think 5 or 6 months back during the GITEX exhibition in Morocco. So it's possible. The devices are not that much expensive. All you need is some amount of investment. For some of the kiosks, the whole setup costs for about $20,000. which is not a huge investment for the government or other partner implementing partners or donor partners. Once we have that, we can implement, because as you can see, the mobile penetration and also the mobile usage within our country, it's increasing, and it's the projectile there's a projectile growth, which is good. This will help in implementing and deploying such platforms, which will help them. For example, we can implement, I can give you an example where I previously worked at the South Omo zone. There was a health center in a community called Mali. So they have about 5 or 6 health centers. So you can deploy such kiosks in five centers. That will cost about $100,000, and the connectivity is good. That is more that is the most remote area that I am aware of, and there is still 3G internet connectivity. So it will be it is actually possible to use that. And the major thing is to integrate the kiosks with the telehealth platform or software, which uses, so the tech stack or the technology that you need to work on should be flexible, with modular architecture that can host such kind of the process or services, something like serverless architecture. So if we have such kind of platform, then it will be easier to access a physician in Kurambasa or at his home or at his office, medical office, and the kind of interaction between the patient at that area, the one I have mentioned, and the specialist within the Black Lion Hospital using the platform. So the kiosks, they're usually actually managed and run by nurses or health extension workers within that specific health post or health center. So yeah, it's possible. If you provide me with the investment, I'll do it. That I can promise you. So I think it's okay. We have another one from Betty. It is a known fact that people of Ethiopia are usually skeptical about healthcare in general. Yes. How do you think we can overcome that and promote the usage of telehealth in such settings? Yeah, it's difficult, but what you can do is, yeah, we need to. I know it's a buzzword, but we need to emphasize on the fact that we have to provide more awareness, more education. Once we achieve that, then it will be possible. But this is actually to be led by the government, not by private institutions or NGOs, because it will not be feasible in our country. I can tell you why. For example, when we talk about the adoption of AMR, no one within I can't say no, but most of the facilities were not looking for an EMR to be implemented by our project. These hospitals or health centers were not expected to spend anything, any dime. So everything was covered by the USAID, because it was funded by the USAID organization as a implementing partner, is supported by the Ministry of Health as well. But the government came up with, the ministry came up with this standard, what you call Ethiopian Healthcare Alliance Quality, EHAC, and the fourth cycle, they came up with digitization, or having electronic medical record as a requirement within the standard. So if you have that, then you will have some points, and it will help you get that recommendation, that price by the end of the annual review meeting. So this has been the way to tackle such issues. Even though the project and stakeholders have been working on implementing EMR for years, what changed the scenario, or what changed the implementation, was the introduction of such standards or such guidelines by the Ministry of Health, by the government. So the government said, yeah, if you don't have such AMRs implemented within your facility, then you will not fulfill these criteria. So yeah, everyone, and out of nowhere, everyone wanted an AMR within their facility, and we received a lot of requests after that. So what I was trying to say is, unless the government understands and charges forward with such implementation and creating awareness and providing such resources, it will not be possible. But even though our people are skeptical, yeah, it's possible. It can be done. Thank you. I think that's the last question.
Yeah,
Thank you, everyone, for the questions. Yeah,
yeah, it was a lot of questions, and thank you. You have addressed all of them.
yeah. I need some
Yeah.
water.
So, on behalf of Blue Hills Ethiopia and all our participants, and also Yana Hills, I would love to thank you for taking the time to present on Blue Hills virtual seminars. So, this is not Dr. Abel's first virtual seminar. He has previously presented on multiple sessions regarding digital health. Previously, in collaboration with Yana Hills, he has presented on the basics of digital health. So, interested participants who missed his previous sessions can access them in the YouTube channel. So the other thing is, we hope this seminars will continue with you with other topics, related topics. And if you have any last remarks that you want to add, Doc.
Okay, so yeah, I have been wanting to mention that starting from today, that's this November 4 to November 10, we are having the Digital Health Week globally. So there is an issue with my connectivity. I'm trying to share the link. Okay, I'll share the first one. So you can actually join. This one is led by the WHO and other stakeholders. You can actually join and participate. There are a lot of events. I have shared digitalhealthweek.co, which will be live till November 10. So you are welcome to participate in any of the workshops, any seminars, and also interactions, and also some courses as well. The other one is I wanted to share is we have been starting this one this morning. So if you are using LinkedIn, okay, let me, it's not, LinkedIn, we are currently changing the profile frame to digital health for this week. So if you are looking for something like that, I'll share you the form so that you can upload your profile picture, and I'll send you with the changed, with the frame, the image with the frame, to celebrate and also create awareness, and also um, uh, and also push forward with the digital health awareness and initiative. So I will share it here, and that's it. Thank you very much.
Thank you. Thank you very much, Doctor, and good night.